I'm going to be your nurse for today. So we're going to be doing a musculoskeletal system assessment. Is that okay?
Yes.
So we're going to be looking at your joints and your muscles. Is there any history of any joint disease or muscle problems?
No.
Not in the family or with yourself?
I'm not aware of. Nothing I'm aware of.
Okay, great. Okay, so the way we're going to do the assessment is we're going to start from head and work our way down to your toes, okay? So I'm going to go ahead and palpate your temporomandibular joint here. So if you can go ahead and open your mouth. Any pain with that?
No.
Any clicking or crepitus? No. Can you move your chin to your right? To your left? Good. Okay. So what I'm going to be doing with all your joints is basically something similar to that. What I'm going to be looking for and inspecting is any warmth, any redness, any masses. I want to go ahead and palpate for any clicking or and ask you, of course, if you're having any pain with any of your joints. And basically that's what we're going to do throughout the whole assessment on all your joints, okay? So next, what I want to go ahead and look at is going to be your range of motion on your neck. So if you can go ahead and just look to your left for me. Good. And move your neck to the other side, to your right. Look towards your right. Yeah, just like that. Any pain with that?
No.
Okay, now look up. And go ahead and bring your chin all the way down. Okay, now what I want to go ahead and test for is basically the strength on your neck. So I want you to go ahead and kind of push against my hand here, okay? So kind of go ahead and lean over. Perfect. Okay, and again. Great. Okay, now go ahead. I want to keep taking a look at your range of motion on your neck. Go ahead and touch basically your ear on your shoulder. So just like this. Good. Any pain there?
No.
And do it again on the other side. Okay, wonderful. So I'm also going to be looking at symmetry. I want to make sure that everything pretty much matches. Like for instance, your face symmetry, no any droopiness or anything like that. No, everything's looking good. Same thing with your shoulders, which is what we're going to be looking at next. So for your shoulders, I'm going to ask you to go ahead and stand up for me. So I'm going to go ahead and test your strength right now on your shoulders. Go ahead and push up. Good. Okay. And now I'm inspecting. I'm checking for any crepitus, any clicking. Do you feel like you have any clicking, any pain?
No.
Okay. Good. So now we're going to be looking at your range of motion. Your arms. Go ahead and pick up your arms like this, all the way up. Any pain there? And down. Bring your arms all the way back. All the way back. Okay, and kind of touch your back. Good. And I'm gonna ask you again to go all the way up, and I want you to touch your back, just like this. Okay, no pain there either. Perfect. Now go this way, up outwards, just like that, with your arms all the way up, and all the way down. Now with one arm, I want you to go ahead and kind of just touch the opposite side, just like this. Now I'm just going to feel. Go ahead and bring it back down. Go ahead and do that again. Any clicking and no pain? Go ahead and do that on the other side. And bring it down. Now I want you to do that, but coming upward. So, yep, perfect. Okay, other side. Great. Any problems doing those exercises?
No.
Okay, so now I'm gonna continue to work my way down. Stay standing. I'm looking at your elbows now. I'm gonna go ahead and assess your elbows. So I don't see any abnormalities here, anything that sticks out in any way. Now I'm gonna do your check for strength, okay? So go ahead and kind of come up. I want you to come up like that and just go against my arms. Good. I'll do just on one side. Go ahead. Great. And again. Good. Okay, bring them down. Now I want you to go like this. Bring your arms out and kind of turn around like this. Turn them around. Go ahead. Again. Okay, so no clicking. I don't see any redness or swelling, any tenderness when you're doing that? No. Okay, so now we're going to go ahead and take a look at your hands, okay? Now the hands have many tiny little bones, so we really have to go ahead and kind of inspect every little bone on your hand. So by basically palpating very closely. So that's what I'm doing right now, on all the way down to your fingers. And what I'm looking at as I'm inspecting is any deformities. Do you I'm assuming you're in college now and you're doing a lot of computer work?
Yes.
Okay. Any pain when you're like typing or no? I know you guys always constantly write papers. No, you get no problems.
No.
Okay. So turn your arms like this. Now I'm gonna test for strength on your fingers, on your hands. So I want you to pull against my hands. Okay. Good. And now down. Bring them down. Good. Now close your hands like this. Make a fist. Now I want you to bring your thumbs over like this. Reach over to your pinky. Okay. I'm assessing your wrist as we're doing this also. Turn your arms around like this. Okay. No clicking. Bring them up. Or bring them down. I'm sorry. Down like this. Now I want you to bring them up. So now we'll go ahead and we're doing strength. Up. Now down. Good. Do your elbows again. I want you to come up. Okay. Now turn them around like this and bring them down. Great. Okay. So everything pretty much looks good as far as your shoulders, your head, your neck. I didn't see any abnormalities. I want you to go ahead and lay down for me. We're going to take a look at your hips. So go ahead and lay down. Just face upward. So face upward, just like that. Good. So I'm just going to put I'm going to be palpating here on your hips. Any problems with your hips?
No.
Have you had any fractures anywhere? Have you broken any bones?
I broke
your wrist.
Yeah.
Okay. I didn't feel for any abnormalities. Everything looks good. Okay. So I'm going to ask you to pick up one of your legs here. Pick it all the way up. Good. Any pain there?
a little.
A little. Where's your pain at?
I'm
When
not
you
that
pick it up?
flexible.
Oh, okay. But other than that, no pain. Okay. Now bring your knee up. Bring it up. Okay. And I want you to go ahead and kind of take it out this way. Good. And the other side. Do you have any pain when you're doing that?
No.
No. Okay. Bring it back up. So I want you to go ahead and come again. Push up. I'm basically testing for strength. And now bring your leg down. Good. Good job. And let's do your knee again. Great. Okay. Now we'll do the other side, okay? Kind of same thing. So bring your leg all the way up. Bring it all the way up. Any problems? No. Okay, bend your knee. Any issues there? Any clicking? So this is all range of motion, but we're also looking at any pain when you're doing that, no? Okay, bring it back down. Now we're gonna do your strength. Bring it up against towards my arm, good. And bring it down, push down, great. Okay, so we're not gonna do your knees right now because I wanna go ahead and take a look at your toes, okay? So I'm just gonna go ahead and remove your sandals here along with your socks. So this is kind of also similar to doing your hands because there's a lot of little bones here, so we wanna go ahead and just kind of make sure we are inspecting everything. So I'm inspecting, I'm looking for any warmth with my hands by palpating, but I'm also looking for any redness, any swelling, any masses. Go ahead and kind of move your foot to your right. Good. And move it to your left. So this is what I'm testing for. This one here is going to be your testing for strength. Do it again towards your right. Go against very good. Now go up, toes, and down. Okay, so now I'm going to go ahead and palpate. Looking again for any abnormalities, any deformities. Okay, now let's go ahead and do the other side. Okay, let's test for strength. Bring bring up your toe. Go against me, basically. Push up. There. And push down. Now to the side. Go towards, good. And now to the other side. Great. Now let's look at all these little bones here, looking at all the toes. I'm palpating, but I'm also inspecting while I'm doing this. Okay, so now for both, I'm looking for symmetry. So I want you to go ahead and kind of bring your feet in. Good. Any pain with that?
No.
Bring them out. Good. Okay. Okay, go ahead and kind of sit up for me. I'm going to take a look at your knees now. So I'm palpating, I'm inspecting. Any problems with your knees? Usually a lot of people, especially young guys like you, I'm assuming you're an athlete, you run a lot.
Yes.
Any problems with your knees? No? Any clicking? No? And no pain, of course, right?
Yeah, no pain.
Okay, go ahead and bring your knee up. Bring it down. Again. Bring it down. Okay, now let me just go ahead and just kind of see if there's any differences in between legs when you bring them up. See if I feel any. No, and down. Good. Okay, everything looks pretty good. Go ahead and stand up for me. We're gonna take a look at your spine now. So if I can ask you to go ahead and remove your shirt. So we're gonna be looking at the spine here, and we're inspecting to see if basically he has a good curve here. Pretty much here at the lumbar, we want to make sure that there's curvature there. So I'm going to ask you to go ahead and touch your toes. Bend down, touch your toes. So I'm looking for symmetry. Go ahead and actually tuck your chin in. There you go. And so we want a good curve. We want a good C curve like this. And that's what I'm inspecting here. I'm looking at. Now go ahead and stand up. And now I'm going to palpate down, all the way down the spinal process here. Any pain when I'm palpating?
No.
Good. Go ahead and tuck in your chin to your chest. Bring it down. Here we're looking at, we go sideways, and again we're looking at a good curvature here. Make sure there's nothing abnormal. Okay, again, so now I want to go ahead and test range of motion for your spine. So what I want is, I want you to kind of just turn this way without moving your hips. Towards your left, they're very good. And now towards your right, we're looking at range of motion, movements, okay? Now I'm gonna go ahead and ask you to go kind of sideways like this. Yeah, all the way, good. Any pain when you're doing that?
No.
Any tenderness? No? Any clicking that you might hear? No. Okay, so pretty much everything looks pretty normal. I didn't see any abnormalities. You don't have any clicking with the joints, any tenderness with your muscles. So I think this is a pretty good normal exam. Okay, well, thank you.